We are presenting an international comparison of diabetes, looking at two developed countries, the United States and the United Kingdom, and a developing country, China. Diabetes is an epidemic afflicting over 420 million people worldwide. There are two forms of diabetes, type 1 and type 2. Type 1 diabetic individuals are unable to produce insulin due to autoimmune attacks on their pancreas. There is no known form of prevention for type 1 diabetes. Type 2 diabetes affects about 90% of diabetic patients, and those individuals are less sensitive to insulin due to overexposure to the hormone. Type 2 diabetes is largely preventable, with risk factors including being obese, having cardiovascular problems like hypertension, and having high sugar intake. Poor control of diabetes can cause grave complications, including heart attack, kidney failure, stroke, vision and nerve damage, and leg amputations. Lack of early detections, availability, and access to primary care professionals limit the treatment of diabetes. For this presentation, we will focus on reforms these three countries are implementing in their respective health systems to provide cost-effective preventative care to manage and reduce the incidence of diabetes. To better compare each country's response, we will first provide an overview of each country's health system.
The United Kingdom has a classic example of socialized healthcare, with the pioneering Beveridge model establishing the National Health Service in 1948. The National Health Service is a regionalized system serving each of the four nations of the United Kingdom through a regional governmental organization and financing. Healthcare is both publicly financed and delivered. NHS funds come from general taxes, and doctors in the UK are predominantly government employees. The large size of the NHS means that the focus is on primary care and disease prevention to save costs. China's healthcare system is also very centralized, but because of coverage gaps in nationalized health plans, there is more private industry involvement than in the United Kingdom. China's healthcare is managed by the National Health and Family Planning Commission. Healthcare is a right for citizens of China and is financed through public and private health insurance. China's system is considered an out-of-pocket model, although the nationalized health plans provide subsidized pricing for Chinese citizens. Wealthier people will frequently purchase private plans to extend their coverage. Private health insurance fills in the gaps in coverage of public health insurance. This includes covering deductibles and copays that come with medical services not covered by public health insurance. Treatment is especially challenging in China because of the lack of advanced technology and insufficient practitioners, especially in rural areas. The United States has the least socialized system and has a dispersed healthcare model. Healthcare financing and delivery is private, with the exception of a few government programs for specific populations. One such program, Medicaid, is especially important for diabetes prevention since it provides coverage to the low-income communities most affected by diabetes. Because diabetes disproportionately affects lower-income Americans, Medicaid plays a large role in financing diabetes care. Medicaid is government-subsidized health care coverage that provides cheaper prices for those who qualify. Medicaid is paid for through general taxes as well as premiums and copays, although there may sometimes be nominal amounts. Most Medicaid recipients are likely to experience coverage gaps that significantly reduce patients' access to care.
The prevalence of diabetes continues to rise worldwide. 9.1% of the global population is affected. Prevalence in the United Kingdom is lower than in the US or China. However, it is still at epidemic levels at around 4% of the population and rising. The United States and China have much higher rates, with diagnosis in 9.3% of Americans and over 11% of Chinese people. The rise in diabetes prevalence mirrors a meteoric rise in the prevalence of obesity in each country. In the United States and the United Kingdom, this reflects the diet of lower-income citizens, with a diet high in fat and sugar and lacking nutrients. However, in China, it is the opposite. Higher-income Chinese individuals living in urban areas are more likely to have diabetes because they can afford to eat a more unhealthy Western diet. As the prevalence increases in each country, the costs are becoming increasingly difficult to control. Diabetes treatment costs account for around 8.7% of healthcare spending in the United Kingdom, around 13% in China, and over 14% in the United States. These price increases are largely a result of insufficient preventative measures and disparities in access to care, which reduce early detection and education. In order to combat these price increases, the respective governments of the UK, US, and China are modifying their delivery models to improve primary care and reduce disparities.
Currently, the majority of diabetes care is focused on post-diagnostic care. This would include medication, management of symptoms, and complex procedures to combat complications. This causes costs to rise excessively as diabetes causes a variety of multi-systemic symptoms that hurt quality of life. Many diabetic patients are forced to retire early as chronic pain, high blood pressure, and edema, among other symptoms, hinder them from keeping up with the pace of work. Diabetes causes cardiovascular complications requiring expensive surgeries to remove emboli and thrombi, as well as treat post-stroke and infarction symptoms and prevent death.
While these three countries have varying degrees of healthcare coverage and accessibility, all three have somewhat poor treatment outcomes. In the United Kingdom in particular, despite excellent healthcare access, there is overall very poor diabetes management, with rates of inadequate HbA1c control at over 42% in 2006. HbA1c is a test of blood glucose. This is similar to rates of control among Medicaid patients despite the lower rate of access due to coverage gaps in Medicaid that are not found in the NHS system. Similarly, China's system is riddled with coverage gaps, and only wealthier people can afford to fill those gaps with supplemental insurance. These gaps, also seen in the United States, can reduce access to adequate and necessary care, resulting in low usage of preventative services, delayed diagnosis, and delay in the filling of prescription drugs, which can make the disease more harmful. In addition, much of China's rural west has high rates of prediabetes, which is alarming due to the lack of medical infrastructure in rural communities. In an effort to reduce the current primary care inefficiencies, each country is making reforms to its healthcare system.
China implemented new insurance policies that are aimed to cover a greater portion of the population. These policies include the Urban Employee Basic Medical Insurance, which is an employee-based insurance, the new Rural Cooperative Medical Scheme insurance policy to cover individuals in rural areas, and the Urban Resident Basic Medical Insurance, which covers the unemployed children, students, and disabled individuals in the urban area. The United States is also attempting to expand coverage through the Affordable Care Act, which expanded the qualified population for Medicare and Medicaid coverage, and economically incentivized the purchase of health insurance. Medicare and Medicaid also increase access to primary care and preventive measures, which improves outcomes, thereby reducing costs. The United Kingdom focuses its reforms on lowering patient wait times to be treated by healthcare professionals and provide better quality of care by making changes at the group and organizational level. Some of these changes include focusing on team development among physicians and improving organization culture to deliver more effective care.
In order to successfully curb the rapid growth and prevalence of diabetes, it is crucial that the United States, United Kingdom, and China continue to reform their healthcare systems by developing innovative primary care strategies and increasing access to care.